Welcome to the South Asian Public Health Association Spotlight Series, the platform where we spotlight remarkable journeys and career trajectories of trailblazers in public health, with a special emphasis on the South Asian community. We're your host. I'm Rubana, co-chair of the Advocacy Committee at South Asian Public Health Association.
And I'm Samira, the president for SAPHA. So, SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the US and the communities in which they live, and has been instrumental in fostering collaborations, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we continue a series of interviews commemorating the 25th anniversary of SAPHA. As your hosts, we are thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
So for our 11th episode of the year, we're honored to have Isha Weerasinghe with us. She's the Associate Director of Mental Health and Wellbeing at the Center of Law and Social Policy, focusing on youth, young adults, and mothers. She previously served as the Director of Policy and Advocacy at the Association for Asian Pacific Community Health Organization, where she worked on improving access to culturally, linguistically appropriate care for Asian Americans, Native Hawaiians, and Pacific Islanders. She also served on the board of directors for SAPHA on the membership committee and as well the executive committee during 2015 to 2017. Isha, welcome to SAPHA Spotlight Series. We're so excited to have you on with us today. So to start off our first question, share a little brief overview of your journey in the field of public health and how did your career path lead to where you are today?
Thanks so much for having me, Romana and Samira. I'm really thankful to be a part of this. As I was sharing in the just before we started, my journey is not brief, but I'm going to try my best. I Before public health was a major, I studied it in undergrad and really became interested in it. I was pre-med and realized like this is what I want to do with my career. And was really interested in this course called Race, Ethnicity, and Health, which I took during a semester took, which I consider like my semester abroad. I went to school on the East Coast, but did a semester at Berkeley. And that particular course really changed the way I thought about racial equity, health equity, but I didn't have the words for it yet. But I think it really changed the course of my career. I still thought I was going to go to medical school after undergrad, but my first, I think, impactful job after undergrad was working with the New York State Department of Health AIDS Institute. And I really learned about policy and harm reduction and about the amazing facilities in New York City that are working to serve a lot of populations. And I also learned about how people with lived experience and how providers could really lend their expertise to change policy guidelines. So that's when I was like, okay, is there a way for me to work on public health and policy together? And then I ended up going and getting my graduate degree in international health policy. I went to school in London and then spent the next couple of years working in global health and honestly became quite disillusioned with it, and which I can get into at a later point. But then about 15 years ago, started working for the Center for the Study of Asian American Health at NYU. And that's when, right before that is when I started my trajectory in working in health equity. So I worked in New York City on the ACA had just passed, so we were trying to help Asian Americans, Native Hawaiians, and Pacific Islanders really understand the impacts of the law um, on our communities. And I was also doing community-based participatory research in Hep B and hepatitis B, and also doing a lot of hepatitis B advocacy. And then after CISA, I ended up moving to Washington, D.C., where I still live. And I became the hepatitis B policy fellow, at the time, the only person in the country who was working on federal policy for hepatitis B. And I was working at APSHO, the Association of Asian Pacific Community Health Organizations. And then from there, like continued to work on health equity. And I was like, oh, this is my jam. So worked at APCHO for 6 years, ended up becoming director of policy advocacy and really understanding the critical role community health centers play for our communities. And then was also doing some soul searching and at the time, and recognized my own journey was and the my own journey, personal journey, and my career journey needed to have more of a intersection. And I did some exploring around myself being a caregiver for my mom, who has who experiences a severe mental illness. She has schizoaffective disorder, although her diagnoses have changed many times over the years. And recognizing the stigma in my community and in Asian American communities, and also recognizing how I had learned all these tools in policy and advocacy, and there was something I could do about it. So that's what brought me to CLASS, the Center for Law and Social Policy, to work in mental health. And I've been here now almost 7 years.
Wow. I mean, that's really inspiring to hear, just especially how like you've used, personal life and circumstances to motivate you to implement, just some of the work that you're doing and intersecting them. And I think a lot of us are very motivated by even just what we see in our personal lives and just what we see in the world around us. And so it's very inspiring to hear your journey. Um, and just moving a little bit to your time with SAPHA, would you be able to explain to us how you became involved? And what sparked your interest in South Asian public health specifically? I know that you did a lot of work in the AMHPI community, but what drew you to SAPHA in particular?
Yeah, so I learned about SAPHA through the APHA connections, the American Public Health Association connections, and in parallel, I think in the ANHPI space, like as I said, worked a long time in national advocacy, and then started out on the city level. But in New York City, there is a lot of focus on the South Asian community. On the national side, there was not. And I wanted to figure out how to tie in my background and my roots to the work that I was doing. So that's what got me interested in working with SAPHA. I think also, if I recall at the time, the board was not entirely policy focused, and that was my focus. So I thought there was something I could lend to the board as well. So that's what got me interested in SAPHA and how I knew about it.
Thank you.
Yeah, thank you so much for bringing your skills and perspectives to SAPHA. I think you started something that I definitely advocacy is now building on. So thank you so much for that. I know mentorship has been really important to me and my career, especially in public health. Are there any mentors or role models who have influenced your career? And what lessons have you learned from them that you would like to pass on, oncoming public health professions?
Yeah, this is a tough question to answer because I think that there have been many throughout my journey, and I'm going to name a number of people. But I don't think that this is an exhaustive list. but there have been, I would say, like really invisible hands, like to support me along my journey. What I did recognize when I was thinking about role models and mentors is they're all women. So from my time at the AIDS Institute, there was a doctor I worked with, Dr. Sharon Stancliffe, who spent her career focusing on harm reduction. And I would go with her to methadone, buprenorphine clinics, and to learn more about the challenges people who use substances experience, and especially if they have complex needs, like if they're HIV positive or have AIDS. I remember so this was very, very early on in my career. I remember telling her that I wanted to go to become a doctor, and then, but in order to be able to practice public health, because I felt like, oh, okay, well, being a physician would help people to understand that my voice carried weight in the room. And I remember her telling me that's not a that's not a good reason to go to medical school, like to spend that much money and that much time. That's not a good reason to go to medical school. And I really heard that, and I eventually followed her advice. Um, I, in terms of health equity, Dr. Kamara Jones, is just a phenomenal person in the health equity space, right? Listening to her speak has really influenced the way that I have worked, and my journey. Um, More personally, in the community health center space, there's powerhouse. Her name is Sherry Hirota. She led this FQHC, Federally Qualified Health Center in Oakland, called Asian Health Services. And she was our APCHO's board chair when I was the director of policy and advocacy for part of the time. And she was a real mentor to me, and helping me on my career journey. And really was like, she did not say no. She would not accept a no. And she really taught me about how what true leadership could look like. Um, and there have been two people who have really like supported me on my journey, Peggy Nagai and Rosie Abrium, who were part of the Center for Asian Pacific American Women. And I was part of a leadership institute that Kapal led, and really count on that sisterhood even now in my career. And both of them were, I would say, definitely invisible hands for me. And then at CLASP, two very powerful powerhouse Black women, Keisha Bird and Dr. Nia Westbay, who were our youth team leaders, taught me how to lead and how to look outside of a scarcity mindset and really think about how we just need to make the pie bigger. And I think that that's really important when we think about public health too, and what we need for our communities. And then the last two people I'll name are Kara Page and Dr. Kima Taylor, also two very powerful Black women who I both now consider my friends, who have been very powerful in both thinking about healing justice. Kara Page is one of the co-founders of the Healing Justice movement, and also thinking about mental health equity. So I name all of these very powerful women because I think it's important to name everyone. And I know that this list is not exhaustive, but thank you for that question.
Yeah, it's great to hear just about, all the people that have really shaped your journey to get to this point. And I know you had mentioned this a little bit earlier, specifically around your time with global health, but as you reflect on your career, what would you say is like the biggest lesson you've learned, or one thing that you wish you knew before you started, that other people should probably keep in mind?
Yeah, I think one is that when I mentioned around pre-med, you can practice public health without having to have the pre-med background. I have now in my career met many, many, many very powerful public health professionals who did not have that background whatsoever. Um, so that would be one. Yeah, and then yeah, I think trusting your gut. I'm still trying to listen to that my own advice. Um, I knew that I wanted to do public health from an undergrad, as I said, and I knew that that class that I had mentioned was really pivotal in my life. Um, so that was health equity from the start, but yet I went in a very circuitous way to get there. I don't regret any of the career choices I made. I think that they helped me. Um, but I wish I had trusted my gut more. And then the last piece I will just say, which I tell people who are earlier in their careers a lot, is that it's okay if your career path is not linear. I actually think it can be really advantageous if it's not, because you learn what you like and you learn what you don't like. And then you also you gain more tools for your belt as you with the more experiences you get. So I'm all about non-linear paths.
Yeah, I can relate to that a lot, especially the pre-med to public health track. I think
Yeah.
Me as
a lot
well.
of people, yeah.
I think for me it was so interesting because like I didn't know public health existed. I thought you could only be a
Yeah.
doctor and help health. But I knew I wanted to be, big picture, big population health. But I just thought that being a doctor was the only thing. So when I was an undergrad, I got exposed to some, community-based organizations. I was like, oh, this is a thing now.
Yeah.
Okay.
Mhm.
But yeah,
Mhm.
thank you so much for sharing that. Earlier we were talking about how you were able to bring really policy work to SAPHA, but I'm also really interested in learning more about, the personal side of working in SAPHA that you experienced. So what were some of the moments or social aspects of being in SAPHA that you enjoyed most? And what were some memorable experiences or connections that stand out to you?
Yeah, so the work with SAPHA was a lot of it was virtual. I'm not sure if that's the case now. But yeah, so I I would say that I really, really enjoyed meeting everybody in person. So we had an in-person meeting during APHA, I think. And it was really nice to be able to connect with everyone in person. I will also say I do really remember the chai and chat that year. Um, Dr. Vivek Murthy, who was when he was the Surgeon General before, he was the speaker, and it was great to see like my work colleagues come to that chai and chat and to see the SAPHA board there and to have the opportunity to really connect in that way was really beautiful. And I also will just say like the SAPHA network has been very beneficial for me too. Um, Dr. Supriya Misra, who was also on the SAPHA board, she and I connected on Twitter, actually, because both of us were SAPHA board members.
Mhm.
And now I consider her a friend and a close colleague. We work on a few things together in mental health, and we're actually presenting on a panel together in December. So very thankful to SAPHA for many reasons.
Yeah, I think the social connections you make through SAPHA really, I think because you're coming together for a reason that's bigger than just like work. And it really, I think
Right.
there's just so much more connection that happens as a result of that. So I can definitely resonate with that. And like over the past 25 years, SAPHA has really achieved a lot of milestones as the board keeps expanding and as people come and go. But we've made some significant milestones in research, advocacy, national health campaigns with impactful engagements in Washington, D.C., and making a strong impact on South Asian health. So, looking ahead, where do you think SAPHA can be most impactful in the next 25 years, given everything that we've been working on so far?
Yeah, so I think it's around uplifting the amazing work that people are doing within the SAPHA community. Uh, Absolutely, like the brown papers, and I know we spent a lot of time during my time at SAPHA also working on that dissemination. But to figure out how to make some of those connections with different ethnic different organizations that represent ethnic communities, but different ethnicities, but also like maybe even outside of the public health space.
Mhm.
Um, I think that that's really important. So I think now that SAPHA is, for example, a member of NCAPA, the National Council of Asian Pacific Americans, I think that that is great. So then NCAPA gets to learn more about what SAPHA is up to, but it's really, I think, really about keep doing what SAPHA is doing, but figure out different and creative ways to uplift the work.
Yeah, yeah. I mean, definitely being a part of coalition helps a lot to exchange ideas and do that work.
Yeah. Yeah. And this, I mean, this podcast is one way too.
Yeah, thank you so much for sharing that. So now I'm pivoting a little bit to the broader public health issues, particularly those affecting South Asian communities. So in your work at the Center for Law and Social Policy, you're focused on reframing public health, mental health, and well-being to be more inclusive. I know earlier we mentioned the stigma that really exists in our communities. So, how can organizations like SAPHA contribute to creating a mental health framework that is culturally responsive and accessible for South Asian communities?
Yeah, thanks for this question. So I think it's less about creating a framework and more about uplifting what works for South Asian communities.
Mhm.
So I'll give an example. We have been doing some focus groups with Bangladeshi communities in both Michigan, just outside of Dearborn, and in Austin, Texas. And so we wanted to learn from these communities what, when they think about mental health, what comes to mind and what are the kinds of solutions that would work for people. And some top line things that we heard were absolutely around stigma, but around shame. Like always, it's like, what are people going to say if we talk about mental health? And then what we didn't think would happen, but were very pleasantly surprised, is that in all four of the focus groups that we did, we actually separated the focus groups by people who identified as male, people who identified as female, to try to create a sense of safety or a sense of security. What we didn't realize is that with all four focus groups, the people in the groups wanted to continue talking. They wanted to figure out, like, how do we continue this conversation going? Because in many of instances, not with everybody, but in many instances, this was the first time they spoke about mental health at all. So I I'm saying that to say, like, there are very different ways that we have not accessed our communities. I will, but my I come from the Sri Lankan community, and I know for sure we have not talked about, like, I don't talk about mental health beyond my family. We don't talk about it within our community. And I think that there are many different ways we can be uplifting what solutions are working. And I think that's what's going to help uplift for policy because the frameworks, they're starting to be there. I worked with a number of organizations to create an immigrant mental health framework. I think what in terms of policy solutions that can be knowing the solutions that work for South Asian communities can be a good complement to some of those bigger policy frameworks.
Yeah, that's really helpful to hear. Just to expand on that a little bit more, given your extensive background both in mental health policy work as well as advocacy work, especially with the A and HPI communities, what do you think are the most crucial changes needed on a systemic level for the mental health system to better serve the South Asian community specifically?
There's so many. Okay, so we're going to prioritize. I will say, I say this all the time. I will just say it so because this is recorded. Our mental health system is broken. It does not serve anybody, let alone our communities. So in order to think about change, ideally the whole system would be changed. But if we're trying to think about reform, something that we do within our work is to try to push for coverage of services that aren't the typical one-to-one therapy appointment. So how do we reimburse for services that are non-traditional care, so like more within community, more culturally appropriate care or culturally sensitive care? How do you think kind of outside of the box of a 50-minute visit with a therapist? And how do you make sure that people could get reimbursed for that? We also try to push for peer support, which, as the example I provided with the focus groups with Bangladeshi communities, that was very clear that that was needed. So how can we think about peer support in our communities when there's like it's like a catch-22 because we don't want to talk about mental health, yet because we don't talk about mental health, people don't want to go into the field. And then at the same time, many of us want to see, if we're going to be talking about our mental health, we want to see somebody who looks like us. But if we aren't talking about mental health in the first place, people are not going to pursue the careers to be able to support those needs. So I really think like those are kind of the changes we can make now. Talk about the importance of addressing mental health within our communities. Encourage people I see a lot more young people, a lot more South Asian young people who are getting into these fields, but also to recognize that it doesn't have to be psychology or psychiatry, like working in counseling, working in social work, working as a peer support provider, working as a harm reduction counselor. Like these are all really powerful professions. I'll end there.
Thank you so much. I think definitely being a Bangladeshi American myself, I definitely hear the need for those spaces to talk about mental health, but also the stigma that really exists in the community. And like you mentioned, the shame that exists. So I think it's important to really have platforms to just start talking about things like that. I also want to, I know you mentioned the focus groups, but can you share more about some other current projects, initiatives, or research that you are currently working on and how they align with your passion?
Sure. I will just one thing, Rabana, when you were talking, it made me think about how when I started sharing the story about my story and being a caregiver and also sharing about my mom, I mean, I was so scared to share that story. And I had a conversation with my dad before writing it. I wrote it for APCHO for the first time. And we had a conversation about it. We're like, are we ready for this story about my mom, my mom's life and our lives to be out there in the public? And And we decided together, and that was really important to me, that I would share, and I did. And after that point, a lot of people came up to me and were like, "Oh, I experienced this too." And I think the more that we share about, I mean, within the comfort level that people have, but the more that we talk and we share, and whether it's in like a more public space or not, you're sharing with your family, you share that you go to therapy, like, and the more that we normalize this, I hate using the word normal, but normalize this,
Mhm.
um, the better for all of us. So in terms of projects, yes, I told you about the focus groups. That's part of a larger body of work that actually Dr. Misra had started in thinking about how South Asians describe mental health. How do we talk about she and her team are focused on psychosis. Like how do they describe psychosis? From our perspective, we're trying to think about mental health writ large, and then also thinking about policy implications. So we're working on that. I mentioned the immigrant mental health policy platform that we just released earlier this year. We worked with, I think, like 16, maybe close to 20 groups across the country working on immigrant mental health, with various immigrant groups to put together this policy platform. And we're going to continue to disseminate that. And then what I want to do next is to really think about how we can think about it in this moment post-election, because that's going to be it. It's just a shift in how we think about policy and mental health policy. And then I'm working on this piece focused on the mental health workforce and impacts or lack thereof on people of color, historically disenfranchised communities. And then have been doing work on maternal mental health, but we are really focused on birthing persons who are people of color, have low income, and may have barriers to the system. So we're planning to do some focus groups with birthing persons with lived experience, and then have been talking to policymakers and advocates in both Michigan and Colorado.
Wow, it's great to hear just all the work that's been happening in the background. And I'm grateful that we can, use this platform to elevate that work. And, just given your background in both community-based participatory research, policy advocacy, and coalition building, how do you see these three areas intersecting to create impactful change, especially with the incoming administration?
That's a tough question. Okay, so in terms of CBPR, I think when done well, and that by that I mean really making sure that community partners have equal say from research to publication. I think that's what we're going to need in this moment is more community voice. I think that's the way that policymakers are going to hear what we have to say is more storytelling, more community-based data. I think that is really critical, more qualitative data. So I think that is going to be very powerful. I think in terms of policy advocacy and coalition building, this is a time where we need to be building or maintaining coalitions. I think there are a lot of people, as I said, I live in DC. Post-election, there are a lot of people who feel very burnt out. And I'm not saying this is only DC, but I just really feel it here. And we're only at the beginning. the administration hasn't even started yet. So I think coalition building is critical, and to understand that like we can't do everything, but we can do a lot if we do some bridge building, and that's not only um, with public health to public health groups, but I think across issue areas, there are ways that some people can lead and some people can support. I have been trying to make this point as much as possible. I was talking to a mental health advocacy leader organization who is a leader in the field, and trying to convince them to do this too. So I think it's really, really critical that we focus on coalition building to move our to not only do defense, but also to move things forward.
Yeah, absolutely.
This has been a wonderful conversation. I think for you to take the time to be brave and share your own family's challenges with mental health, I really hope people who are listening can feel like they're not alone and can start having conversations themselves. So thank you so much for that. As we come towards the end of this podcast and we start to wrap up, one last question for you is, public health for decades have been really in the background, and with pandemic, was suddenly in the limelight. Public health community faced a lot of challenges like burnout that you mentioned, and continued feeling like there's burnout, significant, cutting of budgets, mistrust, and often attacks on public health community and agencies. So as we, given all of these challenges and what's to come, what advice do you have to motivate the next generation of public health professionals to keep doing what they're doing and not lose hope in the impact of public health work?
So I would say, one, it's important in this moment to focus on even small things that bring you joy. I think that that's really, really critical. We have been asking these questions even as like icebreakers with partners. And for sure, people have been like, I cannot find joy in this moment. But what brings one partner yesterday said, what brings me purpose is the cup of coffee I drink every morning. So to really like focus on the micro level and think about what brings you joy. I think it's also critical to find out who your people are, and maybe your people are like is one person or like a couple people, but find out who your people are and talk to them. Just make sure that you have someone who is like a sounding board and who's there for you, especially when things are going to get tougher, because they're going to get tougher when we're thinking about public health. And then I think the third is to make sure that, now I said that you find your people, but also make sure that your people aren't focused on exactly what you're focused on. I was at a all-day meeting yesterday, and one of the speakers was David Hogg, who was in the Parkland shooting. And he was talking about how when the young people from Parkland were just with each other all the time, they were starting to like get angry with each other and like direct all of their bad energy toward each other. And they realized, like, when they started to talk to people outside of that space, that helped to give them purpose. So I think that is also really critical, that we think about people outside of public health and talk to them, and we talk to people who are who are other people of color, who share other identities that maybe that are marginalized. Like we do that bridge building because that's the way we're gonna get through. It's like shifting perspectives, understanding where we are in this fight together. So those are the three pieces of advice I would give.
Yeah, thank you so much, Isha. I think a lot of people can resonate with that advice, especially as we prepare for the incoming administration and just remembering that, the best way to move forward is to move together and ensure that like we all have each other's backs as we prepare. So, thank you for taking us on this incredible journey through your experiences and insights. It's been an honor to have you here as a guest on the SAPHA Spotlight series. And to our listeners, thank you for joining us on this milestone episode. Stay tuned for more conversations with past SAPHA board members as we continue to explore the career progress of individuals who have paved the way for change within the world of South Asian public health. Follow us on YouTube and Spotify by subscribing to our channel. And if you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. Until next time, this is Samira and Rubana signing off. Thank you all.
Thank you.